ulnar nerve syndrome. This is part or related to carpal tunnel syndrome. I think everybody has somebody that has gone through carpal tunnel syndrome with numbness in the hand. If you have numbness on the pinky side of the hand, that is specific for compression of a different nerve at the elbow called the ulnar nerve. Now, although numbness in the pinky might seem like a minor problem, ulnar nerve compression is a major problem. We see a half dozen or more people every week with this problem. It is common. It's extremely common in workers. The problem with ulnar nerve compression is that the ulnar nerve controls every single muscle in the hand except one. So it controls about 20-some muscles in the hand, and if your ulnar nerve compression is let go, your hand will lose all the muscles inside and it becomes crippled. It becomes a claw hand and does not move. So this is a very significant problem. I'm happy to see on the computers and in some of the books they're starting to call ulnar nerve compression cell phone elbow, because it is compression at the elbow on the pinky side of the elbow, and that's making it more catchy that people are realizing that there can be a problem. So yes, using your cell phone or bending your elbow a lot puts pressure on the elbow or puts pressure on the nerve at the elbow. That is not the main cause of ulnar nerve compression. On your arm, on your forearm, all of the muscles that bend your fingers and bend your wrist, they're your big muscles of the forearm. All of those muscles attach on the pinky side of the elbow. And if you reach up your forearm onto the pinky side here, you'll actually feel two bumps. Those bumps are where those muscles attach. They don't attach on the other side. They attach on the pinky side. When you do heavy work or repetitive activities or even nervous activities that make your muscles that bend your fingers get bigger, the attachments get bigger. Where they attach, a nerve goes underneath. That's the ulnar nerve, and when those attachments get thicker, they'll push on the soft ulnar nerve and squish it. So the diagnosis is easy. Most people will come in and say, my pinky keeps on going numb. Very few people realize the weakness in the wrist or the weakness in the hand, but we can usually see in more advanced cases that the muscles between the bones of the hands are starting to atrophy. Insurance requires us to get an electrical test to assess the conduction on the ulnar nerve across the elbow before undertaking any surgical procedures. It is important to realize that the sooner that we diagnose the pressure on the nerve, the better chance we have of getting the pressure off and getting you a good result. You can't squish the nerve, which is a living thing, indefinitely and expect it to take it and not suffer permanent damage. So it's imperative to get the pressure off of the nerve before any permanent damage is done.